I am Dr. Navin Taneja, Director of the National Skin Center, New Delhi. Aging is inevitable. Aging everybody gets. Aging के अंदर हम wrinkling include करते हैं. Aging के अंदर हम pigmentation include करते हैं. Aging के अंदर हम you say the dynamic lines which are because of the your facial expressions. We include that, and we do include you say the other fine wrinkling, and because of the collagen depletion, the sagging of the skin. So and we have to deal with each and every problem individually. So जो अगर हम कहें कि जो sagging of the skin है, that we can work by simple stimulating collagen. तो collagen हम stimulate कर सकते हैं by simple methodology. With the help of a laser we can stimulate the collagen. With the help of a radio frequency we can stimulate the collagen. And there are certain injectables. With the help of a mesotherapy we can stimulate the collagen. And pigmentation, again, we can possibly treat with the laser. We can treat it with the application of certain creams and depigmentary creams, and we can possibly reduce the pigmentation with the help of injectables like mesotherapy, which we call it as a mesoglow, which reduces the pigmentation. And then the wrinkling, which is a dynamic wrinkling, which is because of the facial expression, that can be corrected with the help of Botox. Botox relaxes the facial expression muscles. So suppose you are having a frown, if it is becoming more or less static and your frown is too much, one can possibly take Botox so that your muscles which is causing frown is relaxed, and you'll get the effect within a week, and the effect is going to last only for 4.5 to 6 months. So we need to repeat it. कई लोग injectables करवाना भी नहीं चाहते because they are reluctant, and they say let us age, and we want to age little gracefully. And so जो method collagen stimulation के होते हैं वो prefer करते हैं maybe rather than injectables. एंड अगर कोई कहता है कि भाई मुझे तो रिंकलिंग चाहिए ही नहीं डॉक्टर साहब, तब इंजेक्टेबल्स यस हमें ज़रूरी होते हैं. इनका कोई साइड इफ़ेक्ट एज सच नहीं होता. अगर हम बोटॉक्स सही तरीके से देते हैं, इट इज़ गिवन इन ए प्रॉपर मसल्स एंड इन ए प्रॉपर डोज. सो हमेशा ये ध्यान रखना चाहिए कि बोटॉक्स को किसी ट्रेन डर्मेटोलॉजिस्ट प्लास्टिक सर्जन से ही लिया जाए, and so that we are getting a desired effect. And generally as a doctor we never overdo the Botox, and nobody wants a frozen face or Botoxed face, which we call, and people want a kind of a natural looking, a relaxed face. So that is what we most of the time do. जो मिथ्स ज़्यादातर ये होते हैं कि मैंने एक बार बोटॉक्स लिया तो मुझे ज़िंदगी भर लेना पड़ेगा. हाँ, द इफ़ेक्ट बोटॉक्स का बहुत अच्छा होता है. लोग प्रेफर करते हैं कि मैं दोबारा 6-8 महीने बाद लूँ, और लोगों का ये सोचना होता है अगर मैंने दोबारा नहीं लिया तो मैं पहले से ज़्यादा रिंकलिंग हो जाएगी. ऐसा ठीक नहीं है. अगर हम दोबारा नहीं लेते तो आप उसी लेवल पे आ जाएंगे जहाँ पे शुरू किया था हमने. इट नेवर वर्सन. एंड बाकी जो फिलर्स होते हैं, अगर हम कहें कि जो सुपरफिशियल फिलर्स दिए जाते हैं फॉर हाइड्रेशन एंड रिजुविनेशन, उनसे कोलेजन भी स्टिमुलेट होता है, एंड इट रियली हेल्प्स इन प्रिवेंटिंग एजिंग. एंड हाइलुरोनिक एसिड इज़ वेरी वेरी सेफ. ट्रीट पेशेंट्स विच आर लाइक एट द एज ऑफ 20-21, because the usage of those smartphones, iPhones, iPads, they constantly keep on frowning because of the concentration. So the frown, if we say, has increased because of the more usage of computers and the kind of different gadgets. So invariably the girls before their functions, or the boys before their specific, or before they date someone, they do take Botox for their frown, which is happening. And now the people who are at the age of 70, they are also taking Botox. So it is not that aging, but if I say generally the age preferred, we say after 21 it is fine to take Botox, but not too early. We shouldn't start too early. The effect of any anti-aging methodology is temporary. That's a common question the people ask me, Doc, it is temporary and it is going to last only for 6 months, 9 months, we need to repeat it again. And my answer to them that our aesthetics are again temporary. We are not the same when we were 25, we are not the same when we are 30. It is keep on changing. So we need to customize your treatment as per the desire, and if we can possibly by repeating the procedure can look great or beautiful at that age, it is great. Rather we are choosing something permanent. There are people who take permanent fillers, or maybe the fillers which are like a kind of going to last, but your rest of the skin sag that the filler is going to remain on the very same side. In case of injectables, we need to repeat the injectables, and in case of botulinum toxin or Botox, we repeat the procedure every 4.5 to 6 months. And with the subsequent injections, generally it lasts little longer. So there are people who are coming maybe for the past 12 years to me. So in those patients, sometimes the Botox even lasting for 9 months or a year. And the filler we need to repeat whenever the depletion is there, and generally it is after a year the people are opting for a filler, and we need to repeat the filler. And I do get patients across India who has really taken up too much filler, or the lips have done too big, so they ask me to work for that, and we sometimes have to hyalase them, correct them to dissolve that hyaluronic acid and revive their aesthetics. The most important thing is your skincare regime, like how you have to take care of it, and the protection is very, very important. And then what you eat is again important. Hydration of the skin is again important. One should take a lot of fresh citrus fruits and drink a lot of water. And by eating a proper diet, you can possibly retard to a certain extent. Take a lot of fresh fruits, take green vegetable, whatsoever is available on earth at that season. Now, after a certain time, like we used to take lemon before also, we used to take a mango before also. Later on, the scientists found out, oh, mango contains vitamin A, vitamin A is needed, or vitamin C is needed. So I'm simply saying everything, every nut is needed, whether it contains omega-3, omega-10 or omega-alpha, it comes some out of the day, but the most of the things are needed, which is there, already there, which we are not possibly taking. We are trying to take synthetic stuff. If we take a good amount of seafood, we are taking nuts, we are taking akhrot, badam, we are through with it, and we are taking a fresh fruits, vegetables, everything we are taking. So we know what nature is providing us, we are taking. Or we think, oh no, I have to take the B complex from this, and everything synthetic. One should not. One should take a whole grains, whole things, everything in a totality, rather than a synthetics.